Hi, and welcome back. Today we're going to be answering all of your questions about cosmetic lasers. So let's dive in. First, we'll talk about what are the different types of lasers. So when we're talking about lasers, there are kind of two overall types. There's energy-based devices and there's lasers. And the difference is key. So when you're talking about lasers, it's a specific wavelength on the electromagnetic spectrum that has a specific chromophore or target in the skin. An energy-based device like IPL or radio frequency doesn't have a specific wavelength and doesn't have a specific target in the skin. So it's a little bit different. But some people will call an energy-based device lasers just as kind of a short form. We can first start with vascular lasers. So vascular lasers is a type of laser that targets red or blue vascular components of the skin. So these are going to be your small telangiectasias around the nose, under eye veins, leg veins, redness due to acne, rosacea, or acne scars, anything red or blue in the skin. These vascular lasers are going to leave the skin intact for the most part because all they target is the vascular component or the hemoglobin in the vessels. So that's going to be your vascular lasers. And then you have something called non-ablative lasers. Non-ablative lasers are going to be all of your lasers that target brown spots and collagen in the skin for regeneration and to remove the brown spots without actually turning the skin into laser plume like ablative lasers. Non-ablative lasers do target and damage specific columns of the skin, leading to regeneration and new skin, but they leave that skin inside where it is so that the skin heals around it and pushes up the dead or targeted cells. So that's a non-ablative laser. So now let's talk about the ablative lasers. These are going to be key to rejuvenation and resurfacing. What they target is the water in your skin. They heat the skin up so much in a controlled manner that it actually turns into laser plume or smoke, which gets sucked up by a smoke evacuator during the laser procedure. What that does to the skin is when you have targeted controlled damage to certain areas of the skin, it forces the skin to go through this growth cascade to turn on all these growth factors and regenerate all that damaged skin and basically make new skin that's going to be younger, healthier, have less sun damage. So those are going to be your ablative lasers. Now let's talk about, you made the decision to do lasers. How do I choose someone for lasers? And this is a great question. There are some certain questions that you're going to want to ask someone before they do lasers on your face. I'd say the most important questions are, you're going to want to look them up and see what their credentials are. Are they a dermatologist or a plastic surgeon or a PA or nurse practitioner that has had specific laser training? Not necessarily a weekend course, but has gone and had one-on-one direct mentorship with someone who is an expert in lasers. A key question you can use, because this may be hard to find out online, is call their office and ask what percentage of their time do they spend doing lasers. And ideally, you want someone who spends over 50% of their clinical time doing laser procedures. If it's anything less than that, you may run the risk of having someone do lasers on your face that just doesn't do a lot of lasers and doesn't have the experience that you need. Another thing you can call and ask their staff is, how many lasers does this person have in their office that they have direct access to on a regular basis? If they have anything less than 5 to 10 lasers, personally, I'd be very hesitant to have that person do lasers on my face, because just like we talked about, all the different types of lasers, most patients need a combination of a lot of those different types of lasers. So if they only have 1 or 2 lasers, if you're looking for a specific problem for them to solve, like laser hair removal, then that may be a good provider for you. But if you're looking for overall rejuvenation or maintenance of your skin over time, you're going to want someone that has, in my opinion, at least 5, but ideally more than 10 lasers in their practice. Most providers who spend over 50% of their time doing lasers are going to naturally have a lot of lasers in their practice because they're going to understand the mechanics of lasers, and they're going to have patients coming in asking them for specific concerns that sometimes they'll need this or that laser. So to summarize, how to find someone, 1, look at their credentials, and 2, call their office and ask them 2 questions. What percentage of time do they spend doing lasers, and how many lasers do they have in their office that they have access to for patients? Doing these steps will ensure that you have someone that is high quality and very experienced in lasers. So let's talk about a big issue with lasers right now. People spend money and have downtime with lasers and are not getting results that they're satisfied with. So if you're a consumer, how can you make sure that this is not you? You know you want to get lasers. I want to invest my time and money wisely. How do I do this? Well, first, you're going to want to find someone that is experienced at lasers. Number 2 would be at the cosmetic consult, be very upfront with your physician or provider. Tell them your specific goals, write it down, and have them make a treatment plan that is customized to you, and learn about what lasers they're planning to use and make sure that their treatment plan aligns with your cosmetic goals. Your provider could see something like a vascular component that you really don't want to treat, or they may be focused on your under eyes, whereas it's the nasolabial folds. At your consult, make sure that whoever's doing your lasers spends time getting to know you, asking what your cosmetic goals are. Let's talk about how to integrate lasers into your overall cosmetic routine. And here's the fact about lasers. If you're someone that's going to invest in lasers, you will spend so much less money over your entire lifetime on skincare, on makeup, because lasers are going to be the biggest change that you can invest in for skin quality. So over 15, 20, or 30 years, your biggest bang for your buck over that time is going to be lasers. Do some research, find a provider that's great at lasers, go and get a good treatment plan for you that aligns with your cosmetic goals, because it will be worth it in the end. So let's talk about, I get asked a lot by my patients, can I do lasers, filler, and Botox at the same time? And yes, you can do it at the same time, but not necessarily on the same day. Depending on the laser, if I'm just doing a vascular laser, let's say for acne, rosacea, or just around the nose, I might do that on the same day as some Botox, maybe some, jaw filler, temple filler. For most cases, you want to do laser, especially if it's an ablative laser or a fractionally ablative laser, on a different day than your filler and Botox. So how I space it out for my patients that are getting ablative laser resurfacing is I'll do a little bit of Botox on the day of their consult, even some filler, and then I'll do some laser either 24 hours or up to 2 weeks later. The one thing I will say about lasers and filler, and this is just a nuance that you may want to remember and discuss with your provider at your consult, is a lot of patients come to me asking for filler on their initial consult that have never had lasers before. Sometimes I will suggest either holding off on the dermal filler until after the lasers, or putting in less dermal filler than we think we're going to need, and letting those lasers do their work. For example, the nasolabial folds is definitely a cosmetic concern for a lot of my women in their kind of 30s, 40s, and 50s and beyond. But my patients are surprised after we do some lasers, we're looking at the before and afters 3, 6, 9 months later, just depending on which lasers we do. Most patients actually do not want any filler to treat the nasolabial folds, just because they're mostly addressed with the lasers because of the significant skin tightening and just kind of overall skin quality. So Botox, for sure, go ahead and do that in conjunction with lasers. Dermal filler, just keep that nuance in mind that you probably need way less than you think you need after the lasers kick in. Let's talk about downtime and lasers. And I think there's a myth out there that in order to get really great results from lasers, you need to have a lot of downtime. And that's just not true. There are a lot of lasers, like those non-ablative lasers and the vascular lasers that we talked about earlier in this show, that actually don't have much downtime at all for patients. So even if you're someone that's working 5 days a week or whatever your kind of work schedule is, a good laser surgeon is going to be able to find a plan that fits into your lifestyle. If you're not going to do as aggressive of a laser and you need something that, in 24 hours or 48 hours, you can completely look back to normal, it may take a couple more sessions, but you can definitely get results that fit into whatever your lifestyle is. So a super common question that I get during my patients' initial cosmetic consults is, I have sensitive skin, can I get lasers? And the answer is absolutely yes. A good laser surgeon is going to help walk you through the process of lasers, whether that's a non-ablative laser, an ablative laser, or an energy-based device that's going to get you great results and take into account your unique skin. Whether you have acne, rosacea, eczema, psoriasis, all of these different things should be taken into account when developing your unique laser treatment plan. I have a lot of patients that can't even tolerate something like retinoids because they just have such sensitive skin, and they do fine with lasers. Maybe they need a gentler post-care, maybe they need less aggressive lasers, whatever it is, we're always able to find a treatment plan that works with even the most delicate, sensitive skin. Thank you so much for listening to our episode on Lasers 101, answering all your questions about lasers. If you have any more questions, feel free to send me a DM or drop a comment below. Thank you so much for listening, and we'll see you next time.